For what purpose does the gentleman from New Jersey seek recognition?
Mr. Speaker, I move to suspend the rules and pass H.R. 2355, the Opioid Prescription Verification Act of 2021 as amended.
The clerk will report the title of the bill.
Union Calendar Number 130, H.R. 2355, a bill to facilitate responsible, informed dispensing of controlled substances and other prescribed medications and for other purposes.
Pursuant to the rule, the gentleman from New Jersey, Mr. Pallone, and the gentleman from Kentucky, Mr. Guthrie, each will control 20 minutes. The chair recognizes the gentleman from New Jersey.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material on H.R. 2355.
Without objection.
And, Mr. Speaker, I yield myself such time as I may
The
consider.
gentleman from New Jersey is recognized.
In April of this year, the Energy and Commerce Health Subcommittee held a hearing to discuss the dual threat of the concurrent COVID-19 pandemic and the opioid overdose crisis. In that hearing, we considered a slate of bills targeted towards the opioid crisis, including H.R. 2355, the Opioid Prescription Verification Act of 2021. We knew then, and we know now, that time was ticking. Millions of Americans were experiencing the deadly pandemic and simultaneously living through hard-hitting mental health and substance use issues. Tragically, we've lost over 750,000 Americans to COVID-19 and over 100,000 to drug overdoses during the pandemic. H.R. 2355 seeks to reduce prescription opioid diversion by directing HHS, DEA, FDA, CDC, and SAMHSA to update and decimate training materials to help pharmacists that dispense opioid medications verify the identity of the patient. To incentivize states to facilitate verification, the bill also authorizes the CDC to prioritize certain grant funding to states that maintain prescription drug monitoring programs and require prescribers of controlled substances to issue prescriptions electronically. Grant funding would also be prioritized for states that require pharmacists to enter certain information about controlled substances prescriptions into prescription drug monitoring programs, including the quantity dispensed, the date filed, and the patient identifier. This bill received unanimous support in the Energy and Commerce Committee and is part of a series of bills the committee has worked on to help prevent diversion of opioids and reduce harmful opioid use. I'd like to thank the sponsors of this bill and my colleagues on the committee for their steadfast work in addressing the overdose crisis. We must continue to work in a bipartisan fashion to combat this crisis in order to keep our constituents safe. And so, Mr. Speaker, I urge my colleagues to support this bill, and I reserve the balance of my time.
Gentleman from New Jersey reserves. The gentleman from Kentucky is recognized.
Thank you, Mr. Speaker. I yield myself as much time as I may consume.
Gentleman's recognized.
Thank you, Mr. Speaker. I rise today in support of H.R. 2355, the Opioid Prescription Verification Act, a bill led by Representative Rodney Davis, along with Representatives Bilirakis and Wagner. The opioid epidemic continues to devastate communities across the country. According to CDC's National Center for Health Statistics, there were over 100,000 drug overdose deaths in the United States from April 2020 to 2021. There is a 25.5% increase from the previous year. The Opioid Prescription Verification Act directs federal agencies to develop, disseminate, and periodically update